Hello everyone, welcome to another episode of ISAY Conversations during COVID. And today we have with us Suyash from India. Suyash, please introduce yourself.
Hi, I'm Suyash. I co-founded India Safe Abortion Youth Advocates with a couple of my friends like 3 years ago. And so we work with a lot of medical students. We aim to sensitize them towards issues surrounding abortion, women's rights, gender rights, sexual health, and all of that stuff. And we started off as medical students, but three of us have now passed out to become doctors.
Yeah.
But we're still continuing the work because there's a lot of work to still be done.
And you guys now have to a point where you have an amazing social media presence as well, where for those who are listening and haven't checked them out, you should definitely see their Insta handle especially. It's pretty creative and nicely done, especially with all the information coming from medical students. So it's obviously had a bigger impact as well. Great, Swish. So let's just cut to the point why we are here. And as you know, we're in India, for the lockdown, it has been about, I think, a month or so, right? Like in 30 some days, and we don't really know what the way ahead is. The government has not been very accurate with the information. Ki kya hoga, how is it going to go? What have you sort of noticed as medical student, someone who always has a gendered lens to you guys always? You've been sharing awareness as well on your social media accounts. So what have you been observing in the past, whatever that, especially in terms with access to abortion for women and other vulnerable groups that are there जिनके लिए पहले भी बहुत मुश्किल होती थी, even in normal circumstances. Yeah. Now the situation is completely. So yeah, just if you could share a bit about that.
I think perspective is important right now because we studied in a government hospital, so there was anyway a lot of stigma attached to a lot of people seeking abortions, particularly in our hospital. But still, there were a lot of abortions being given. I mean, there are obviously very good doctors in certain parts of the hospital. People who will figure out a way if they have to. Right? That's always possible, right? Even the law is made in good faith.
True.
I think the biggest challenge right now is that a lot of these public sector hospitals who are affordable, accessible for a lot of marginalized folks, people who can't really seek a private doctor a lot of the times, these have started to stop providing non-essential services, even though abortion is is written as an essential service during this hard time. But a lot of them have then stopped providing ANC care. They've stopped providing regular clinic care. Also because they've converted these hospitals into some centers for COVID patients. So I feel like this is again a major challenge to some of these people. There was this very interesting thing that happened recently, is that someone wrote to us on our Facebook page and said, my partner stays in India, stays in Mumbai. We want to seek an abortion, but I stay abroad and there's so much lockdown that's happening. And so I was in touch with Dr. Suchitra Dalvi about this. And it was such a hard time for us because they wanted someone to accompany the woman. But the only issue they kept telling us was that if they get admitted, if the woman gets admitted, there's going to be testing, there's going to be so much additional hassle with respect to the virus that can happen. So that's just impeding it so much more. In India, at least, domestic household abuse is a major thing, right? And if you're put in the house with your abuser for over a month, where there is no exit mechanism, there's no safety mechanism, so if people keep a monthly pack of oral contraceptive pills, then it's great. But that month is going to end sometime, right? So at what point do people run out, and then what do they do after that?
Yeah.
And even the most basic thing, like say you have autonomy in that sense, right? And say your partner is respecting of your your choices. How many chemists are still open and accessible to just go out and then go and buy it yourself? Right? And compound that with, I don't think this is a major issue, but people are not earning money as much these days because of this.
I feel that a lot of the governments are sort of doing the bare minimum that they have to do, and there are so many issues that are not even being talked about. On the top of it, they are trying to pick up other issues that are not that relevant. For instance, the MTP Act, right? The amendment that happened. So if you could just talk a bit about when that happened, was that necessary at that point? And what do you see like going ahead, and how has ISAY been sort of involved in that as well during the time of these times? Yeah.
So I personally think that just the idea of even getting an amendment is really good. But for some reason, like I said, it's been hushed in at a time, and there may have been other priorities, and
it sort of seems like they wanted to get done with it and not like really deliberate on it, talk about it. What are the issues and what are the concerns that so many people and organizations that have worked on abortion and have the data and research to prove that this has not been really working, even though it's an amazing act, but it has not been working like we want it to be. So
No, I think you're right. Like you said, it's very tokenistic. It's like we did this now. Just just don't bring it up for a long time again now. But and listening to Suchitra ma'am talk about this, some of what she said was so true, that if you're doing it, you might as well do it in a way that is actually moving towards a pro-choice sort of act, because at the end of the day, you pretend like you want to give autonomy back to the women, but really you're still keeping it all in the state and the doctors. And ISAY is doing this social media campaign that really brings to life the changes in the MTP Act that have been proposed now. We're sort of drawing parallels to what the original law is, and so that way you have a perspective on how much is being changed, and you get an idea about what's being done. So if you look at the new amendments that have been proposed, some of the major points would be they have now changed, or they're proposing to change, that up to 20 weeks you just need the approval of one single doctor, and from 20 to 24 weeks you need the approval of two doctors, which as compared to previously was up to 12 weeks you needed just one, and then up to 20 you needed two. And they've also increased the legal term to how much duration a person can access an abortion to, up to 24 weeks. Apart from this, they've also added the clause that if it's beyond 24 weeks and it's some significant fetal abnormality or a grave danger to the woman's health, they will still provide an abortion, which is great if you think about it, because previously all of these cases had been individually asked to go to the Supreme Court and then file their own appeal, which in itself takes a lot of time, and time is of the essence in this sense. But there is a catch to it, that they've advised that every state should have a board that consists of a gynecologist, an MO, a pediatrician. I don't know. There's a lot of doctors that are required to be
sort
on
of
that
approve
board.
the abortion beyond a certain rule. Okay.
Another big issue with the amendments is that they've said that the state can reveal the names to no one of someone who's seeking an abortion, except a person who's authorized by law, which in itself is absurd, because there's a lot of intricacies that come with the MTP Act, POCSO, the PCP and DT Act. All of these laws are so finely interwrinkled in our country that revealing any person who's had an abortion is just, like I said, it violates the identity thing. So that's, someone really needs to be vocal about this, that this is a big issue. This is one of the biggest reasons why you need to change this. But overall, you can see why they're doing it. It's really important, because it's not like it's suddenly people are seeking abortions, in second trimester. But because everything's been so vocal recently, and obviously there will be criticism, because like we've seen in the United States, people always bring up anti-abortion slogans, and they have these pictures from second and late third trimester or early third trimester abortions.
The imagery,
80 to 90% of people have abortions in the first trimester.
And also about medical abortion, right? It is still, if you can share a bit about that as well in India.
So in India, from what we used to study in our books and all, it says that the medical abortion bill, the PAC, is preferred to be prescribed up to 9 weeks. around
Okay.
63 days. But in the real sense, it is given, up to 12, maybe even beyond 12 sometimes, because it's just that
So
effective.
it's safer, and
Yeah,
it's safer as well, and more.
it's going to be safe for a long time. So I feel like um, India has an issue with accepting that medical abortion can be the best, and I feel like that issue it's been in a global sense much wider as well. That we have had this personal hesitation with letting go of the surgical measures in the bigger sense. I think it also involves letting go of the doctor, which sounds funny coming from me, but it's the truest form of seeking your own fertility into your own hands, because
Giving the
this is a pill
agency
you can.
back to the woman.
Yeah.
And even in times of COVID, like right now, a lot of women would be accessing, the abortion pills over the counter without even a prescription. So to say that it's even accessing that illegally, even if it's not legal, but it's much safer than thousands of other back alley methods that are there. Like we said, we don't really know how moving forward with the COVID. A lot of people are facing a lot of difficulties, but ISAY in fact had collected a brilliant helplines. You guys as a collective that people could reach out to in terms of in lockdown if there is an emergency, because like you said, domestic violence and all other kinds of threats must have definitely increased. Moving forward, how do you see things changing? Because whenever the normal is, how do you see things moving to a positive, in a positive way, if we can see that probably, okay, this is something that we have learned through this pandemic and we need to change the way we've been doing things.
Humanity from the last few years has been working at overdrive all the time. The point I'm trying to make is that there will be, rather there should be at least, a new ideology behind how person-to-person communication works. If we talk from our particular sense, in ISAY sense, I feel like the most elementary thing about seeking an abortion, which was in previous terms, in a public health sector, would be a woman makes up her mind to, I don't want this pregnancy. She fights her own battles, her own barriers. I feel like all of this may change for good, because if you can directly see a doctor from being at home, I think that's perfect. But again, there's a lot of privilege that I'm putting into this statement, that will people even have access to this sort of a thing? I mean, the lockdown's been the only complaint that most of us have had during the lockdown has been boredom, but there's a lot of people who have found a lot more difficulties that we may never know about. So I think it's hard to say how much people's lives will be changed, but it's definitely easy to say that a lot of people will see a lot of different changes happening to their lives. And in terms of abortion, I think we should see a larger number of people using the MA pill, longer than what we used to, as long as it's safe, of course.
And even, for instance, if coming back to a bit closer to home, even gender roles are sort of, because now for the first time, I mean, so to say, so many men and boys are like sort of taking up chores and helping out in the house. And also resources, how we have allocated our resources till now, and how with this pandemic has shown that how some people were at the lowest at the rung that they're there, and for them how difficult it is during a pandemic. I mean, you and I, like, we're better off, like you said.
I think it also goes to show that, like you said, we'll see, but beyond the point, it's also about how much we want to see. Where do we learn from, after all, in today's age? We learn mostly from social media. We look at pages, we follow people, but social media in itself is such an echo chamber, and that's been seen very vastly recently with respect to elections and how public opinion is formed. So if someone follows people like them, you're never going to really see what the poor folks suffered, or what people who didn't have access. So I think
Especially
it's also
with all
about
the
wanting.
Sorry,
It's also about wanting to see what's beyond your sort of strata in society.
True. Yeah, and like also be aware of the fake news that has sort of. I mean, it's like right now, I don't know. I mean, it's difficult for us to sort of differentiate the media houses in India. It has been such a fight that we are all fighting. in terms of even with the whole coronavirus, how the narrative has shifted from completely targeting one community and the politics around it, not required, but it's sort of happening. So yeah, do you want to add something to that? I mean, your observations around how we have been dealing with it on an overall.
Yeah, I think the overall handling of the virus has shown us a lot about who we put into power. And that's just not the leaders that we have, or the media that we follow, or the people we make influencers. I think it's really going to show us that our leaders have failed us big time, and then they failed us again. And the moment we thought they'll get their shit together, they did it again. And our media has been constantly, at least in India, has just been shambles for the longest time ever. But just overall, every day you switch on the TV and there's already the stress of seeing about 8,000, 10,000 people die every day around the world, which has a different toll on you, and a death which perhaps could have been prevented. Perhaps. I mean, sure, the virus is natural and it's going to kill people, but not at this degree, right? And it's debatable whether there was a country to blame, whether there's someone else to blame, whether actions were delayed. But at the end of the day, your actions were in your own hand, right? How you dealt with it. On one hand, you have this virus, and how the only way to deal with it is to buy yourself time with lockdowns and stuff like that. But at the same time, we've got this huge population issue. And I was reading somewhere that in India, even if 99% people follow the lockdown, strict Chinese type of lockdown, that still means that nearly 15 million people are outside. And that just puts it into some sort of perspective. Even if you forget about economic issues, the disparities, housing issues, sanitation issues, that's still a lot of population. And Mumbai right now is like really the epicenter in India right now. And you see these issues cannot be helped anymore by people. Sure, there's definite room for improvement in the handling. There's no questions about that. But beyond all of that, just the way we've been living, right? And obviously, this is a very privileged statement to make, because we're on the good side of Mumbai. Like, we can survive Mumbai, but there's people who can't do that all the time. So I feel like it's a huge challenge for them, and so I've really been holding back myself on criticizing a lot more. I mean, there's definite room for criticism. But when they do stupid things like talk every day about how this virus was made in the lab, or how one religion wants to spread it all, that's really unnecessary.
Not
There's so much more to talk about.
Exactly. True.
Everyone, and the worst is all parents want to talk about it. Every day. It's like an internal fight that's happening.
That's true. And I mean, definitely we could have done a much better job, and like really like, for example, Dr. Manisha had said when we had in the conversation with her that it's the public sector hospitals, for instance, right now who are like really taking up, while on the other hand we are moving towards a complete privatization of, and we see monopoly coming up. So that is also something that we need to think, that do we need that right now? So I mean, a number of questions have sort of come up, and we're looking for the answers.
And so I was listening to ma'am's conversation, and this thought really popped into my head. I'm not sure if this is very relevant here, but when it had just started, when in India, there was this video that leaked of Kasturba in Mumbai, the hospital, of how the conditions of the government hospitals are. People who are handling, and then there was a narrative in people who were sort of upper middle class and above, that this is why you're not supposed to get ill, because you'll be admitted in this kind of a hospital. And at least, I'm not sure if it was in Delhi, but in Mumbai it was all over WhatsApp. Sinks look like this, the wards don't have anything else, the corridors are blank, there's cats walking around. But people don't realize this. We've spent 5 years in a medical college and a hospital, which was a government hospital. That's how every government hospital is. You've been so blinded because we never go there. And I say you, but it's me also. And then the funny part is that most people who study in a government hospital would not have their first choice to admit their family member in a government hospital, which is just something that somewhere our healthcare system has really failed. I mean, the hospital is amazing because the doctors are really good, but the conditions, you don't feel like getting cured over there sometimes.
Yeah.
But that again has so much privilege that we have the choice of not getting cured there. There are people who have only one option sometimes. So, like you said, going forward, I think we really need, our country really needs to look at healthcare in a different sense. And in every country, elections are won and lost based on their healthcare plans. But in India, that's just never been. Like, what healthcare? Like, that's not an issue.
Yeah.
So,
And like probably the amount of money we spend on our defense and all of the other unnecessary statues and stuff, we can put that into really the healthcare at least. And yeah, great. So thank you so much, Suyash, for talking to us, for taking out the time, and all the best for your the campaign that you guys are coming up with. And
do follow us on.
yes,
We just started Twitter. So you can follow us on Twitter or Instagram or Facebook. The handle same everywhere. It's ISAY Advocates or the name of the organization.
Great.
Thank you, Asha. Thank you.
Thank you, Suyash. See you.